Okay, so let's move on to the next review, butt implants review with Dr. Kenneth Benjamin Hughes, amazing experience. 15th July 2020. First surgery was fall of 2019. I got 600cc implants in the butt and liposuction of the back. Dr. Hughes recommended this to get the look I was going for. Months went by. I loved my results, but I just wanted a little bigger in liposuction in the abdomen. We called, had a Skype call with him and let him know what I was looking for. He recommended what we should do and everything, and we booked for a neck surgery. June of 2020, I got my second butt implant surgery with the 712cc, the biggest size. I'm about 6 weeks, and I'm loving the results already. The stomach and sides of my abdomen look amazing also. Dr. Kenneth Hughes is honest and well-educated doctor who will give you the best results he possibly can. So analyzing that, this was a butt implant patient who had not one but two butt surgeries where she decided to get basically the world's largest butt implant placed. And that's okay. Patients just need to realize that the complications with those are greater, mainly fluid collection and the risk for that incision opening and you having to remove the implants. Having said that, I can count on one hand how many times I've had to remove the implants. One was infection. 3 of them had to do with a person basically ripping the drains out, which should never happen. I mean, the drains are tied in with like a fishing line. And so what has to happen is a patient literally has to have the drain catch on something and literally avulse or rip that out of their body, okay, and tear the stitch at the same time. So when that happens, you're going to be confronted with whether or not that fluid collection, which is going to develop, is going to cause that incision to open or lead to an infection or whatnot. That's happened 3 times. There was another patient who fell down and kind of opened the incision, and it just went from bad to worse and ended up just removing those implants. But if if it's not the result of pulling the drains out or, something, like I said, infection is not as common as the fluid collection. But let's say if you're doing things to offset kind of the precautions taken for the surgery, then you can guarantee yourself that you'll either have prolonged recovery or you're going to have to take the implants out. So that's number one about these bigger butt implants. Now, frequently I combine butt implants with maybe liposuction or something because butt implants are doing nothing for the torso or anything of that nature. And so it's very much appearance versus reality. And so I try to inform patients about that, and then they give me their response. Now, the next review is liposuction review for Dr. Kenneth Hughes. Now, this one is in July of 2020 also. It says Dr. Hughes is an amazing doctor. He is Harvard trained and knowledgeable on just about every surgery you can imagine. He is honest and will not perform surgery on you he feels it's unnecessary or if the risk outweighs the reward. He's always available when you need to ask a question or anything. Now, let me just unpack that a little bit because there are several things in there, and it's not Dr. Hughes is an amazing doctor or that he's Harvard trained, although I think that's to some extent important. Now, being knowledgeable about many different surgeries, okay, especially surgeries that may not be performed as commonly, is very, very important because it basically offers up a universe to the patient that maybe has not been alluded to in previous conversations or consultations. And so sometimes these surgeries that maybe other people don't perform may be exactly what that patient needs, okay? So just because a surgeon doesn't perform a surgery doesn't mean that surgery should be abandoned. It says he is honest and will not perform surgery on you if he feels it's unnecessary, if the risk outweighs the reward. So this sounds like a patient who's been paying attention to when I'm talking, because I frequently say this is always about risk versus benefit. Okay, they have to know risk benefit. Okay, so fluid collection, for instance, in butt implants sabotages the vast majority of the results. Okay, out of those results that are, sabotaged. Okay. So let's say that you perform 100 butt implants. I think it's pretty fair to say that fluid collection in 5 of those will figure in prominently. Now, whether or not you have to take the implants out in those 5, that comes down to just optimal management and how well the patient does. There occasionally on the patients who have those implants, they may be able to avoid that, and that's just due to kind of continuing care and things of that nature to make the patient feel, or to reduce the chances that fluid collection is going to open the incision or something of that nature. So the risk-benefit in a lot of these things is just that. It's literally a pretty simple discussion. I try to simplify things so that patients can understand, hey, What he's telling me is I can get a bigger size implant, but that bigger implant will have a higher rate of fluid collection. Okay, that's what the literature shows, and he's just being honest with me. And so he's willing to do these bigger butt implant surgeries, but there's a higher risk. And so that's all I'm doing is I'm trying to basically give patients an outlet for what they want. I'm offering to do these surgeries that may be a little more difficult than someone else would do. But at the same time, they need to realize some of the risk, okay? Now, some of the patients flat out, if I look at them and I can tell that there's no way I can get in a 712 or 715 cc implant. 715 cc implant is the newest one by Implant Tech, so that's now the largest implant by 3 cc's, not that it matters over AART. But when you're doing, let's say you have a person who's 95 pounds and their width is just nowhere close to allowing for that. No, I'm not going to do that. I will force that person to go down to a certain level, okay, before I'll say, at least I have a shot of getting this in, okay? After a while, it just becomes stupid to put in an implant that has a diameter that's so wide there's no possible way it will fit within that individual, and then you're forcing them into a revision. So there are a few people where I either will not do the surgery or I force them to come down. And refusing to do surgery is not a bad deal, because if you're refusing a person because they're just unrealistic or they cannot be kind of be brought into harmony with the laws of physics, then you don't need to deal with that individual, okay? Let that be for someone else.